Hi, everybody, and welcome to today's edition of Wellbeing Live, hosted by the Mental Health Center of Denver, and a special thanks to our presenting sponsor, Cigna. Wellbeing Live is a series of short virtual talks, workshops, and classes given by our experts from across the organization on topics related to support your well-being and the well-being of those around you. My name is Eliana, and I work in the Development Office at the Mental Health Center of Denver. Today, we are particularly excited to hear from Darcie Ezell and Beverly from Dahlia Campus and Mo Betta Green, who will talk about the importance of connection during COVID-19. If you have a question during the presentation, please submit it in the Q&A chat in the upper right-hand corner of your screen. And with that, I'd like to introduce Bev. Take it away.
I want to say greetings to everyone that tuned in, and thank you for tuning in.
Darcie, you want to tell us a little bit about yourself?
Hi, everybody. I'm Darcie Ezell, and I'm the Community Engagement Coordinator here for the Dahlia Campus for the Mental Health Center of Denver. And I have had the privilege and the pleasure of working here for going on 7 years now. And I'm really excited to be talking about the campus today. So to continue on, I just want to talk a little bit about what's going on at the campus right now in regards to this time of COVID and how we've really had to pivot in regards to, in particular, our food programs. So I'm just going to give a brief overview about what we're doing, and then we'll go back to Bev, and she can talk a lot more about this. So we have had to, instead of doing a farmer's market this year, we've had to really just kind of switch our processes. We're doing a drive-up food box program on Wednesdays on the south side of the campus at the farm near the parking lot, and we're doing a farm stand too, so our neighbors can come up and just purchase food that we're growing right here on the campus, as well as Polidori sausage, Gold Star hot links, Ela Farms fruit. And then on Thursdays, Miss Pam with People's Community Food Projects is doing her food pantry on the west side of the campus, and then Bev on Friday is doing her farm stand on the north side of the campus. So 3 days a week we are distributing food from our amazing farms, and we're really proud of how quickly we kind of had to shift gears, and how we're still really getting a lot of food out to the greater community. Bev, did you want to add to that?
Yes. I'd like to say that you're right. In response to this COVID time, we increased our food access on the Dahlia campus to 3 days. And what was beautiful about it is we're all working hand in glove with, beginning on Wednesdays, which is our traditional farmers market night. We're featuring the greenhouse, which is our year-round anchor of food access here at the campus. And then they are partnered with the large acre farm that you notice as soon as you enter the campus, and they are the ones doing the distribution on Wednesdays. Then our pantry program on Thursdays has really done a great job with keeping connection to the campus via the pantry, and also other things that people need for their homes. Different supplies are also available on Thursday. Then I wrap around on the 35th side of the campus, which is the north side, and we created 2 farm stands, a walk-up and a drive-up, where that way we could access people, socially distanced, and still keep them connected to farm fresh foods. We're sad about not doing cooking classes, all the active living things that we would normally engage people in, a myriad of educational opportunities. But given that we have to stay home these days and eat and sustain ourselves, food is our foundation. And we've really made food access a number one priority, and doing it in such a way to remove barriers. We have a pay what you can model available. We can accept SNAP, which is food stamps, and the accompanying double up program. And then also through our pantry program, things are just given to people. And so the Dahlia Campus, with the partners here, we're really working closely together to remove those barriers for folk around these neighborhoods. And Darcie, what would you say that maybe I'm not thinking about?
Yeah, that was a great description, Bev. So one thing that I think is really important to point out is that the Dahlia Campus has been here for almost 5 years. So it'll be 5 years January. And luckily, this didn't happen in year 1 or year 2, because we've had this opportunity to really build up what Bev was just referring to in regards to working really well as a team in regards to food access, as well as having the community folks know that we're here and that we're growing food and that we continue to grow food for them. Currently, the harvest is just going crazy. We have everything that you could possibly want, from tomatoes to peppers to zucchini to eggplant. So pretty much anything, leeks and potatoes. And so it feels really good that as a team that we're still continuing to have this great mission of what Dahlia was created for in regards to community and keeping community engaged through food. We've always called the farms and gardens our front porch, and that has been never more true than right now. I feel like even if people aren't going to be coming to purchase food, they will come out just to chat, and they'll see us out, and the seniors across the street or people will be out, and people are lonely and socially distanced, and people wear their masks, but people are coming just to engage and just to feel a sense of community, and that's really what Dahlia was built for people to feel like they could just come over here and that it was built for them in this Northeast Park Hill community and beyond. And I feel like the farmers, as Bev will tell you, are working farmers hours, 50, 60, 70-hour weeks right now, because that's what farmers do. And it never stopped. And it was never a thought to not do that during this COVID time, because we felt so strongly that people need healthy food to keep their immune systems going. And we used to sell about 30 food boxes a week through the aquaponics farm, and now we're selling between 70 and 80 of them. And so word is catching on in regards to that what a great deal it is. And then, like I said, on Wednesdays, we also have the farm stand, much like what Bev does, where people can just come up and purchase whatever they want. And in regards to pay, we can pay what you can. We do a neighborhood discount, and we also take SNAP. And we're also part of the Double Up Food Buck program, which will take an additional 50% off everything that you buy. So it's a really good price point for what you're getting for food that's grown right here, harvested day of or day prior, straight into your mouths. What do you think, Bev?
Well, I couldn't say it more poignantly than you, and I agree. Now, something that I would love to share with you all that also happened this COVID summer is I was a booming youth employee. I had 22 youth hired, and I divided them into teams, and they helped with the land stewardship, with growing the food, weeding, whatever was needed. And then when we implemented farm stands, which we have every Friday here, and then I also have a Wednesday farm stand at a farm site where I'm growing. They're both 100% youth run. We had the contactless payment options for people. The youth learned to run that, and SNAP and everything was built in. And I think having the youth there to welcome shoppers has really been the heart of the success of our farm stands. We sell out practically each evening, and then I also ensure that every single youth is taking home a couple of bags of food to their families, because what good is it for them to work in this environment and then not take it home? I remember when they were kind of shy, like at the beginning, to take things, and they would take one tomato and a couple things, and I'd say, how many people live at home? And I said, so what you have in your hand, that's going to be like a half a bite for everybody? You got to take enough stuff home to make a meal. And so it's grown from that, and I would tell them, that's your homework, to take the food home. And as the season progressed, and now children are not children, but the youth are beginning to return to school schedules, and I had college students, some are leaving the state or just preparing to be online in their parents' house, whichever the case. Knowing that we're ramping down a bit due to that, and having had a whole season of sharing food, knowledge, them showing me pictures of what their families made with the food, them coming to me and telling me, oh, the stuff out the store doesn't compare. This is letting me know, hey, those are the unmeasured degrees of success that have come along with this COVID season, that we have blessed additional families through the youth employees. So I'm exceedingly grateful for that. One last thing I'll share is I have started a medicinal food forest on the north end of the campus, because it's a perfect complement to what is already here on campus with the annual farm that Renee Marcoux is in charge of, and our beautiful greenhouse. So briefly, a medicinal food forest contains perennial things like fruit trees, berry bushes, various flowers, and herbs that balms, salves, tinctures, and teas can be created. And so that is the next level of things that will be happening from right here at the Dahlia Campus, primarily and always with DIY in mind, meaning anything that you see growing here, and especially in that area, is something you could duplicate at home. And the things that I'm teaching you to make in the kitchen when we're able to reconvene, these are things you could go home and make tonight. So it's a blessing to that how this time has created a challenge and a call that I feel partners of the Dahlia Campus have answered beautifully. We are still breaking barriers. We are still increasing access. We are changing lives. So back to you, Darcie.
And we are still creating community. So for those of you who don't know, we were in the community for 2 years before we built the Dahlia Campus, just really talking to the neighbors, talking to other people in the neighborhood about what they'd like to see in their neighborhood. Bev was one of the very first people that we'd spoken to. She grew up in the neighborhood, had visions of farming on the spot. It had laid vacant for 20 years before the Mental Health Center of Denver bought it. And so the things on the campus were what the community told us that they wanted to see here, including the food. It's a food desert. There's not much access to grocery stores in this neighborhood. So not only do we have food, but we also have a pediatric dental clinic that's run by Kind that is now open on Wednesdays. And we also have the Sewell Early Childhood Development Program that's also open and taking kiddos 2.5 to 5-year-olds. And so I just wanted to make sure to point that those programs have since opened. And of course, we're also continuing on with the mental health services focused on children and family here at the campus. And so community, this is all about community. It's about food access. It's about health and wellness. and it's about family. Both my daughters worked with Miss Bev this summer as two of her youth, and have for several years, and just consider themselves really lucky to have that opportunity to learn so much about food, how food is medicine, what nutrition does to a body, immune systems, and then just kind of the tribe that we've created here with all the farmers and all the partners. And then, of course, I just also wanted to shout out again to Miss Pam Washington with People's Community Food Projects and the work she's doing, since she's not on this right now, but on Thursdays from 2 to 4, she is doing her food pantry, which you just drive up or walk up and grab a box full of really healthy, fresh fruit, vegetables, canned goods, prepared meals. So if people that you know are hungry, have them come out on Thursdays from 2 to 4 on the Dahlia side of things, on the west side. Bev, did you want to talk a little bit about the engagement process from the very beginning at all?
Oh, sure. And thank you for an opportunity to speak again, because as you were speaking, Darcie, a couple of things came to mind. Number one, many people are not aware about how special the land that the Dahlia Campus now occupies, how special that land is to this neighborhood. Because it used to be the largest Black-owned shopping center in the country, but it was the exterior model, like a strip style. Long story short, I grew up as a youngster coming here. I would like to point out that yes, Park Hill is a food desert now, but when the shopping center was thriving and we had a store there and a store where the Boys and Girls Club is at Holly, this neighborhood was not a food desert. And so the ability to come back to the land that I grew up on as a child, and thousands of people have come on this land, before and with me. It's really a privilege to be here, to be a part of the solution of bringing food back to this neighborhood, of educating people around it, and also creating access to what I call the health equation, which is healthy food, active living, social, emotional, and mental support. There's education, advocacy, friendship. It's all here. And that is because people in the early days, like Darcie, Dr. Lydia Prado, and others, were literally walking the streets. That's how we met at an event. And when people like myself and others shared with you the history of this neighborhood, and how we were glad that someone wanted to listen to what we had to say, and then more than that, take what we had to say and take action with what we had to say. So that is how this Dahlia Campus manifested, and that is why it is available to the community to come here and convene once we are able to do that, to host events, to have family reunions or weddings, to come and do yoga, Tai Chi, whatever. Take a cooking class, take a Spanish class. This is what this campus is about. And, I'm grateful to the Mental Health Center of Denver for being progressive enough to accept this new model, because this is different to the traditional MHCD. But because MHCD is a stellar organization and a beacon in our community, I believe that is why you all took this risk and you see how it paid off. So that's it for me.
Thank you so much, both Bev and Darcie, for all of that wonderful information and history and the context around Dahlia Campus. We do have a few questions that have popped up, so I'm just going to start. I'm going to send this one over to Darcie. Can you describe Double Up Food Bucks a little bit more?
Yes, I can. And then I might have Bev add a little bit more because she's a little bit more of an expert on this. So if folks have SNAP benefits or EBT benefits, there is a handful of stores and places that also take Double Up Food Bucks, which is a federally funded program that's funneled down to states. The people who work with it here is Live Well, and we're part of that. So that takes, you get a Double Up Food Buck card in with your SNAP card, and that takes an additional 50% off your local produce and local foods. So it's actually a 50% more savings that you get. And another thing that I want to talk about in regards to SNAP is that Colorado families can now apply for pandemic EBT or PEBT, and it's available through the Colorado Families with School-Aged Children. And basically what it is Denver Public Schools, since they weren't able to feed the kiddos last spring, when all of this started happening, you can automatically get $279 put onto your EBT card for your SNAP benefits. Then if you use that with us, then you're getting the 50% off with the Double Up Food Bucks as well. So thank you for asking that question. That's really important to note that Bev with Mo Betta Green Marketplace, as well as the Dahlia Campus, takes SNAP and Double Up Food Bucks, which is really, really great. Bev, did you want to add anything to that?
Another way of thinking about it, when I explain about the Double Up Food Bucks, generally, let's say someone purchased $10, then the Double Up would allow them to receive $10 additional in free produce, or produce at no cost. So it will double your purchase up to $20.
Oh.
Mm-hmm. Or match your purchase up to $20. That's a lot of produce.
That's pretty fantastic. Thank you both so much for answering that question. Let's move on to the next one. And Bev, I'm going to have you answer this one. What is your favorite part of working with Dahlia Campus? And side note, thanks for all your great work.
Oh. Well, the kitchen. I would have to say I love the kitchen, but really I love the people. That's my favorite part of the Dahlia Campus. Learning the neighbors and building rapport with them. Additionally, building with the staff that's here at Dahlia on a regular basis. And then, like I say, if you all haven't seen the Dahlia Campus kitchen, AKA my office, I love that place. So that's what I love.
Thank you so much. So there's two questions that are kind of related. So I'm going to ask both of these, and Darcie, I'll send these to you. So the first one, kind of part one, what can I do to support my community right now in a safe way? And part two, what can we do to get involved during COVID? And do a lot of community members get involved at Dahlia Campus? So really around community involvement and specifically during COVID-19.
Yeah, thank you. I think that a great way to support yourself and to support your community, I think what I've been doing is getting on the phone and calling seniors in the neighborhood. Seniors are not going out very much, and I feel like that is a really good use of time, is to get on the phone, and I'm very committed every single day. I call at least one or two seniors and talk to them on the phone, and it really improves, I think, the mood. The other thing I would say in regards to that is the campus is beautiful right now, much thanks to Bev and our other farmers, but there's sunflowers blooming everywhere, there's flowers everywhere, And you can't come on campus, but the sidewalks are real great around the campus. So walk around the campus and maybe grab a friend. It's supposed to cool down here. I think the heat's supposed to break tomorrow. So maybe, take a walk around the campus and just see how pretty it is. And do it on a Wednesday or a Thursday or a Friday, and we'll be out there to engage in some conversation. So those are two ways that I can see that would be a really great way to support yourself and the community.
Thank you, Darcie. So Bev, this one's for you. It sounds like you've created a family for the youth that work with you on the farm. It sounds like this is an amazing opportunity for them. Is there a success story that you could share with us?
Wow, that's going to be hard. One thing I'd like to share with you guys, we had a few medicine making workshops, and there's a plant called comfrey that is designed for bone health and pain. And so the youth made a balm out of it, and then that was homework. They had to take some home, try it, and just give me some feedback. Well, I had two youth come to me, and one said, Grandma tried it, the other one said, Grandpa tried it, who were both regular arthritis sufferers. And they wanted to tell me they love this. They really felt a difference. And I said, did you explain that you helped make this medicine that they are utilizing? And they said, yeah, that made it even more special, which kind of gives me a chance to segue back to what a new level of goal with what I'm doing with this medicinal food forest, to cultivate plants, to teach the youth and anyone ways to heal yourself. Because I feel like more of us must adopt a DIY approach to our health, and that's a way to reconnect to the land. And so I'm gonna stop there.
Thank you, Bev. So this is the last question, and this is going to be for both of you, but I think, Bev, we'll start with you on this one. Where do you see Dahlia Campus in 5 years, and do you think there could be another campus?
I see the Dahlia Campus in 5 years being so busy that we need another Dahlia Campus, but somewhere, another model, because this is a holistic, whole person approach to health here. And what I call the DIY way is at the heart of what drives what's going on here. And so that's what I see in 5 years, a demand for another Dahlia Campus, because this one is overloaded.
Christy, what about you? What do you think?
Well, I would completely agree with Bev. I do kind of what she was talking about earlier. I really have to give credit to the Mental Health Center of Denver, the leadership of the Mental Health Center of Denver, and how committed they have continued to be to the community. And I do know that at the Mental Health Center of Denver, there's a lot of talk about perhaps opening up another Dahlia Light campus somewhere else in the city based on the success of this campus. But that would be a very different community, right? One community is one community. A different community, we would get a lot different feedback. So I think that I do see Dahlia Light campuses popping up. We get people during normal times, people come to tour the campus all the time and would love to replicate it. And then in regards to the campus itself, I think in 5 years, what we've done in 5 years has been amazing. In another 5 years, it's like Bev said, I think that we're just going to bust out of this place. It's going to be too robust for all of us. And the farms and gardens are just going to, continue to mature and become even more, if that's possible.
Thank you. So thank you all so much for joining us today. We are going to end here. Particular thank you to both Bev and Darcie for all of the work that you do with Dahlia Campus and for sharing all of this wonderful information with us today. And thank you for leading us in such an engaging such an engaging session on the importance of community during COVID-19. We also want to thank everyone who tuned in with us today for this edition of Wellbeing Live. Please share this with your friends and family. You can visit our website at www.mhcd.org/wellbeinglive. And you can fill out the form on our website to be notified of upcoming events. So we look forward to having you next time, and thank you again.
Thank you.
Thank you too. Yay.